Welcome to the Natural Way to Better Health and Wellness. I'm Dr. Donald DeFabio. Today it's all about back pain. That's right, the show's all about back pain, and I chose that for several reasons. The first is that it's the number 2 reason that people present to a doctor's office is back pain. Number 1 is the common cold, upper respiratory infections. The second most common reason people go to the doctors for back pain. So there's a lot of people out there that suffer with it. It's actually the number 1 disability for work-related injuries in the workplace. So back pain is really endemic. It's really something that a lot of my viewers suffer from, and frankly, I see it all the time in my office. You know, I have to laugh a little bit because I've been doing the natural way since, 2006. I've been on TV 36 with Spotlight on Berkeley Heights since 1999, and actually I've never done a show about back pain, and I'm a chiropractic doctor. I'm so committed to sharing information that I oversaw something that's really important to everybody out there. So how are we going to approach this? Well, we're going to approach this from how you relate to back pain. You see, what it is there are several scenarios that I commonly see in the office related to back pain. It's the person that just gets back pain because they didn't really do much other than just bending forward. And then I have the athlete that works out all the time that gets back pain. Of course, we get the person who's a little stiff and tight and has some arthritis in their spine. Stenosis can be in there. The older population gets back pain as well. And lastly, we're going to talk about that sciatic patient with the pain shooting and burning down the leg. So those are the scenarios we're going to talk about, how to treat them, and what you can do to get rid of your back pain, and if it's sciatica, leg pain, and get your life back. So that's what it's all about. Now, there's going to be some common trends with all of these scenarios. So let's get that out of the way first, and then we'll roll into what's back pain all about, and what you can do to get rid of your back pain. The common scenarios are, number 1, when you go to the doc, you need an accurate diagnosis. Without an accurate diagnosis to differentially diagnose what's causing your back pain, you're not going to get the results that you want, all right? So what's my job when you come to my office? It's to give you a thorough examination, simple orthopedic, neurologic, chiropractic, functional testing. Let's find out where the problem is. What does that mean? It means, is it a joint problem? Is it a bone problem? Is it a nerve issue? Is it the muscle? Is it the ligaments or tendons? Is it the disc? Is it 2 or 3 of those things? The bottom line is I need to analyze all those different parts of the body, check their function, check their mechanics, and see what's going on. The good news is research has shown up to 80% of back pain is mechanical in origin. So very rarely is it related to things other than what I just mentioned: bone, nerve, joint, muscle, ligament, or disc. So let's figure out what that is first. Then, once we figure that out, we can set up a targeted treatment program involving chiropractic care. In our office, it's exercise. In our office, it's rehabilitative exercises. And in our office, it may also include nutrition if that's one of your weak links. So it's that comprehensive, holistic approach to back pain that really gives you rapid results and gets rid of your problem. And if you follow through with your home care instructions and just basically follow my recommendations, it's not going to come back, which is the big thing we want to achieve. So where to begin? Let's begin with the first scenario. The person who just gets back pain because they bent over to pick up a bottle, or they were just washing their feet in the shower, or they were just twisting and reaching for their wallet behind them in the car. Why did that happen? Well, probably because you're deconditioned. You sit all the time, you're not exercising as much as you used to, or just not at all, and you become weakened through the core. The hips, the lower back, the abdominal muscles, they've all become weak. Therefore, it just takes a little bit of motion to cause the vertebrae to slip and lock up and irritate the tissues. So if I were to take my model, these are a couple of vertebrae, all right? So if we have the 2 vertebrae in through here, pathomechanics occurs when they shift and they get locked up, and then they can irritate the nerve. They can shift to the side, they can rotate and shift, but basically they shift and they get locked up and they stay like that, and it creates pain, all right? When that happens, then you got to get in the office. The best treatment of choice is usually chiropractic care. Research has shown acute low back pain responds extremely well to chiropractic care. And the traditional high velocity adjustment works the best, where we get in there with a short impulse and we cause a separation of the joints to get them to move better. But people say, what's chiropractic adjustment? What is it? Well, I got this great picture for you. I know we're all laughing right now, but the reason I picked that is there's a myriad of chiropractic adjustments. So let's get back to the show. We found the area that's inflamed. You're also going to have a lot of spasm. So we need to address the spasm. We need to address the inflammation in these cases. The best way to address the spasm was with nutritional supplements and water. If you're not drinking enough, you got to drink more water. And if you're having spasm, we look at it with a couple of ways. Magnesium, very, very effective at relaxing the muscle spasms. Sometimes people need calcium. If that doesn't do the trick, or if we need more of a muscle relaxant type of effect, we recommend a wonderful thing called Cavanase. Cavanase is an amino acid with a phenyl group attached to it. 4-methylbutyric acid it's called. But the bottom line is it relaxes the muscles so that you can sleep better at night. So if you're in that deconditioning type of injury where you just twisted and bent and you sit all day long, that's the problem. And exercises for you are going to be seated exercises. Take a look at these exercises that we have this patient doing on the ball. These are the type of exercises that you need to do if you sit all day long. If we were to give you exercises lying down on your back, it's not going to be as effective as doing seated exercises. So again, the exercises, the nutrition, the adjustments need to be tailored to the deconditioned patient. That's what we do. Now that you've got an idea of how we treat a deconditioned patient, we're going to take a short break, and when we're going to come back, we're going to talk about the person that works out all the time, that's in the gym 3 to 5 days a week, and they get back pain. Well, how did that happen? Stay tuned and we'll figure out how to solve those problems. Today's chiropractic tip, wellness. Research has shown that periodic chiropractic adjustments improve spinal function indexes and reduce overall medical expenses by 20% annually. Your health is your best asset and your only real wealth. Take care of it. Call your local doctor of chiropractic for an appointment today. You deserve it. I'm Dr. Donald DeFabio, reminding you that chiropractic is more than just back pain. Welcome back to the show. So what if you're that active person? What if you're that person that goes to the gym 3 to 4 to 5 times a week, taking classes? What if you're walking with the dog every day? What if you're weight training 3 to 5 times a week? What if you go on hikes and cycle on the weekends? You're active, but you're still getting back pain. How come? Well, that's probably because either you have poor mechanics somewhere in your everyday activities, you have an imbalance in your workout, or it could be going back to that sitting if you're sitting all day. So let's go to sitting. If you are sitting all day, you got to sit as we're showing in this schematic. A nice support for the lower back. By supporting that lower back, it keeps the spine erect, keeps the pressure off the ligaments, the discs, the nerves. You need to have support for your lower back when you're sitting. If you're sitting like in this schematic, what's going to happen is it's going to put a lot of pressure on the ligaments and especially the discs. This position, bending forward 30 degrees while you're sitting, puts the most pressure biomechanically on the low back discs than any other pressure, any other position. So if you're in this position and then you just reach underneath your desk to pick up the pencil you dropped or twist a little bit to get the paper in the printer, bingo, your back flares up. So we got to go back to sitting. But let's say that's not the issue. Let's say it's not a sitting issue and you're still working out all the time and you're getting low back pain. Well, again, it goes back to that thorough diagnosis. And what that thorough diagnosis tells me, a lot of times it's not the lower back where the problem is, that's where your inflammation is, but the problem is usually in the lumbo-pelvic hip complex. What does that mean? The lumbar spine, the lower back, meets the tailbone. Now look at this picture here. And then you have the hip bones and the legs. So tightness in the hip sockets creates extra movement at the lower back. It gets painful. Imbalance in the sacroiliac joint, where the tailbone meets the hip bones, can give you back pain. So maybe it's a sacroiliac syndrome creating back pain. And that can happen real easy if you're working out all the time because the joints need to stay movable in the hips. When the joints, when you walk, where the tailbone and the hip bones meet aren't freely movable. They lock up, they jam, they get stiff. It's called pathomechanics. You're going to get pain. And that can happen from exercise, just everyday activity. So we need to find those areas and treat them. Secondarily, a lot of times what happens is there's an imbalance in your workout. Now, how do we know that? Well, we do a functional assessment, and it's called an overhead squat assessment. Let's take a look at this athlete. As you watch the athlete do the squat, look at the knees, look at the hips, look at the feet, look at the arms. You see how the knees go in, how the hips shift off to the side? That's poor mechanics. So every time that person gets up and down out of a chair, in and out of a car, every time they move, they're going to have poor mechanics, meaning it's going to put extra wear and tear on the joints. They're mechanically dysfunctional. We can give you a ton of exercises to strengthen you, but if we don't fix those mechanical imbalances, you're not going to get better. Let's look at this overhead squat assessment, and that's a nice squat. Feet stay straight ahead, hips stay level, arms stay up. Standing on one foot, the hips stay level, the knees stay straight ahead. That's good mechanics. So sometimes we have to teach people how to move better and translate that to their everyday activities or maybe their workouts. Nutritionally, for those athletes, when they have an acute flare-up, it's usually related to inflammation. So we need to talk about things that are going to suppress the inflammation. What does that? Systemic enzymes, bromelain, papain, trypsin, chymotrypsin, all really good ways of decreasing acute inflammation, works extremely well. I like to recommend a product called Zymane. It's an enteric-coated proteolytic enzyme, breaks down the inflammation. If it's just pain we got to deal with, well then we talk about white willow bark, and we recommend a product called Salazan, which is white willow bark, a natural aspirin. Again, if the mechanics of the athlete are off, and we've got the inflammation down, but you're still having some problems, sometimes actually we look to the feet, and we can see if that's a problem when we do the overhead squat assessment, and then we have to go to custom orthotics. Footbeds for inside the shoes to keep the feet level so that they don't roll in and the hips don't shift when you squat, bend, move, and lift, run, do Zumba, hike, whatever it is. So sometimes orthotics are needed. So for that athlete that's active and you're still getting back pain, there's an imbalance somewhere in what we call your kinetic chain, meaning your feet, knees, hips, or lower back. That imbalance needs to be corrected with chiropractic adjustments, with rehabilitative and corrective exercise, sometimes orthotics, and nutritionally, we mostly have to look at shutting down the inflammation as opposed to retweaking your complete nutritional profile. Now, there's two more ways or common conditions that we frequently see in the office. That's the arthritic patient with chronic back pain, and that's the sciatic patient. We're going to talk about those next. I'm Dr. Donald DeFabio. This show is all about back pain and empowering you to get your life back, to get rid of your pain. Today's chiropractic tip, pediatrics. Children have spines too and can benefit from chiropractic care. The procedures used on children are different than those used on adults. However, if you're looking for a safe, natural, and drugless addition to your current health care for your child, consider chiropractic. It may be just what the doctor ordered. I'm Dr. Donald DeFabio, reminding you chiropractic is more than just back pain. Welcome back to the show. It's all about back pain and getting your life back and getting rid of the pain. Scenario one, decondition, just not doing enough, sitting all day long, need core strengthening, core stability, calcium, magnesium, and chiropractic adjustments, the appropriate ones. Scenario two, the athlete, the active person, the person who's in the gym all the time, back pain, imbalance in their mechanical chain, something's not working right. The back is secondary to something else generally. Unless you did something foolish, lifted too much weight, too hard, too fast. That's always a possibility. But usually it's an imbalance in the mechanical chain. Could be the feet, could be the knees, could be the hips, could be the sacroiliac joint. Chiropractic care to fix those imbalances, then corrective exercises to get you to move better in everyday life as well as when you exercise. What's the third scenario? Well, let's show some respect for our patients that have been around a little while, and let's say they're of Medicare age or getting close and they have arthritis. And you got chronic back pain related to arthritis. And again, you don't have to be of Medicare age to have arthritis. Research has shown if you had a car accident, you will have arthritis in your spine of your neck anywhere from 15 to 25 years after that accident. So if you got the accident when you were 15, 18, 20 years old, yeah, you could be 35 or 40 and have spinal arthritis. So arthritis, well, what does that mean? Well, let's take a look at this picture here. And it shows us a nice picture of the spine. The upper part here is nice, the vertebrae, the disc. If you look down at the bottom where the last vertebrae sits on the tailbone, that's arthritis. The discs start to thin, you get some lipping and spurring in there. The analogy I use with my patients is, let's say the arthritis was in your hands, and your hands were all nasty looking, and they were stiff and they were tight and arthritic. Well, what I want to do for those hands is be able to have you go into your hand, take it into your pocket or into your purse, grab a handful of coins, manipulate the nickel, the dime, the quarter, and not drop the other coins. So that's the goal, restore function. So with arthritis, we use different techniques. We use a procedure called decompression therapy, where we stretch the spine. It's mechanical traction. We also use low-force chiropractic adjusting procedures, where we want to stretch the spine. And something that works really, really well is to put the spine through motion using an adjusting instrument. So I can set this instrument to adjust the spine while the patient is moving. Really works great for arthritic spines. So the arthritic spine has a whole nother set of goals and objectives. And we need to address the inflammation and pain. There we go right after the pain, and I usually go with a topical. What works really well are these topicals. BioFreeze and Icy Hot works really well, shuts down the inflammation and pain nicely. Within 5 minutes, decreases circulation 43%. Works really, really well. So for the arthritic chronic pain patient, we need to talk more about stretching for exercise. We need to lengthen those muscles, lengthen those ligaments. Sometimes we'll use a procedure called Graston, and here's I'm demonstrating it, where we take an instrument and we rub it along the spine to relax the muscles, to break down knots, to break down scar tissue, to improve flexibility. So I hope you guys are with me. It's been a lot of information. We're looking at the common causes of back pain and how they can all be treated naturally with chiropractic and with soft tissue work, working on the muscles, and with exercise, whether it's corrective exercise or basic low back strengthening and stretching exercises. We got one more condition to talk about, and that's the sciatic patient. So we're going to take another short break, and when we come back, it's all going to be about disc syndromes and sciatica. I'm Dr. Donald DeFabio. Today's chiropractic tip, whiplash. Do you know your headrest restraint geometry? That's HRG for short. That means keeping your headrest 2 inches above and 1 inch behind your head will reduce your risk of getting whiplash 78% from a rear end crash. Drive smart. Use your car to prevent whiplash injuries. I'm Dr. Donald DeFabio, reminding you that chiropractic is more than just back pain. Welcome back to the show. I'm Dr. Donald DeFabio. It's the natural way to better health and wellness. And again, it's about back pain, getting rid of your back pain so it doesn't come back. So what if your scenario, your challenge is sciatica, leg pain, a slipped disc, a pinched nerve in the back going down the leg, into the foot, into the ankle, into that leg, into even the butt and hamstring. Painful, disabling, and really no fun. Not that the other conditions are any fun. But sciatica is really bad because it really impacts your ability to do everything. Sometimes people can stand, sometimes they can't stand. So it's quite involved. But what is sciatica? Well, it's inflammation of your sciatic nerve. Your sciatic nerve is the largest nerve in your body. How do we know it's inflamed? Well, physical examination, always going back to the first step in the process is an accurate diagnosis. Plain film x-rays are needed first to see what's going on structurally. We'll look for alignment issues and pinching issues. See those a lot of times in the deconditioned patient, in the arthritic patient. In the disc patient, we don't see them as much because the disc is inflamed or herniated. Then we go to the MRI. So let's go to the MRI, and that's how we can confirm it's a disc lesion. How do we treat it? Well, discs need to be opened up and separated. Let's talk about what a disc herniation is. We look at this slide here. On the left, we can see a normal disc. It's like a radial tire on the outside, and on the inside, it's a very watery substance. It's called the nucleus pulposus. It's 90% water, actually. And on the outside, it's very stiff. Again, like a radial tire, lots of bands of a type of cartilage, of thick, fibrous cartilage. Those radial bands start to tear a little bit. Look on the image to the right. And when those little bands start to tear a little, some of that water, that nucleus pulposus, starts to ooze out, and it creates like a bubble on a radial tire or an inner tube. If that bubble pushes out and hits the nerve, bingo, you got a slipped disc with a pinched nerve. You could have a bulging disc, you can have a herniated disc. If it doesn't hit the nerve, you may have some back pain, but you're not going to get sciatica. When it hits the nerve, you get sciatica. So that's what happens. So on this colored model, we see the exact same thing. How the outside starts to tear a little bit, and then the inside herniates through. When that inside herniates through and hits the nerve, bingo, you have sciatica. What do we need to do? Well, it's similar to treating an arthritic spine. We need to open it up. We need to get the pressure off. So the procedures here are exercises and adjustments that are going to open and lengthen. Decompression therapy, again, works very well. Manual traction. Cox flexion distraction is a chiropractic procedure that opens up the spine like this. Works very well. We need to get inflammation out of the disc, though. So there we go back to our anti-inflammatory nutrients. The best nutrients for that are going to be your curcumin, your boswellia, your turmeric, natural herbs to suppress inflammation. Research has shown a slipped disc is an inflamed disc as well. So we need to get those inflammations down. Mucopolysaccharides, your chondroitin, your glucosamine, those can also be beneficial. So we want to add those in. I like to use a product called NutriDisc. NutriDisc has all those things worked in it. It can be used long term, but it works best short term. Let's get the inflammation out of the disc. Exercise-wise, our first goal is to get that disc and get away from the nerve. So it's a lot of stretching in the beginning. We don't give you strengthening. We don't put you on the ball and have you bounce up and down. We might have you doing some walking with therapy. We'll be using a lot of ice. We'll be doing procedures that are going to enable us to get the inflammation out of the area and to shut down the pressure of the disc and inflammation on the nerve. You know, it's ironic, but if you think about it, or this fact, it only takes 3 to 5 millimeters of mercury of pressure on a nerve to create pain. That's why it doesn't take a lot to get pressure and leg pain and sciatica. And conversely, that's why it doesn't take a lot to get rid of it too. So we like to get that balanced. So when it comes to sciatica, decompression works really well. As the inflammation calms down, then we transition into those corrective exercises and strengthening. You need a lot of core stability, strengthening exercises. In fact, we have a really good handout on 3 different levels of core stability exercises. If anybody would like those patient handouts, email me, drdefabio@aol.com, and ask for my core stability exercises. They're excellent for when you're out of that acute phase of care, and they really help get you through. I would say 90% of our low back patients that are recovering from sciatica and sometimes just plain deconditioning back pain end up on these exercises, so let me know. I'll be happy to give it to you. The last question everybody has is, well, what do I need to do and how long is this going to take? Well, guess what? It's very simple. Let's watch this short little clip, and that'll answer the question about what you need to do and how long is it going to take. Amanda, I know the #1 question you have is how long is it going to take and what do I need to do? Well, we're going to look at this very simple diagram that explains it all. Right now, you're down here. You're in a lot of pain. There's pressure on the nerve and it's irritating your lower back, all right? Now, you're in this zone here. You're in pain, you're in inflammation. You're going to need some intensive care to get you feeling better. As soon as you start feeling better, that means the pressure's coming off the nerve, there's less inflammation. Now, this is in your very critical part of your care because, yes, you're feeling better, but you haven't healed and you haven't strengthened. If you continue with the recommendations, you'll continue on to feeling better and having optimum health. However, you're going to have a tendency to want to discontinue and go ahead and do all the things that created this in the first problem, which means you're going to drop down below the pain line and you're going to be back in pain again. And we'll be more than happy to see you at that time. However, once the bone comes off the nerve, what we like to recommend is corrective care to get the mechanics better, to stabilize the area. Again, this is a very simplistic diagram, but you get the concept. Pressure on the nerve, inflammation and pain. Inflammation calms down, pressure's coming off the nerve. You're feeling better, but you're not all better because you're not corrected and you're clearly not stable. This is the rehabilitative phase of care. This means you have to do more work on your own and less work with me, but I'll give you all the exercises to do that, all right? As you start feeling better and you're stable, well, then they call maintenance of health line. You're way up here. That's where you're stable, that's where you're healthy, that's where we can talk about preventative care to reduce spinal decay. Just like if you have your teeth cleaned, it reduces spinal decay. So initial goals, get you out of pain. Research has shown most patients with back pain have a 40% improvement in 12 visits. If we don't see that kind of improvement, we need to look deeper and figure out what else needs to be done. But as soon as you're out of pain, to get that other 60% of improvement, it's going to require corrective exercises and perhaps other things you need to do at home to stabilize your back, change your mechanics at the gym or at work, your ergonomics, maybe some nutritional supplementation. So a little bit of time, a little bit of care, but it really is about consistency with the program to get the results you want. That's what it's going to take to get you feeling better. Wow, that's it, guys. There you go. If you're having back pain, you want to get your life back, it's all pretty straightforward. What do you need to remember? What are your take-homes? You got to have good ergonomics. Your treatment is going to be dependent directly on what your condition is. If it's deconditioning, you got to get exercises and adjustments and work on the appropriate nutrition. If it's you're working out all the time and your mechanics are poor, we got to fix those mechanics with adjustments, corrective exercises, and maybe something to control your muscle spasms when you're real bad. If you're somebody that's got arthritic spine, different type of adjustment, maybe using the instrument, but a low velocity adjustment, along with nutrition to heal the ligaments, tendons, and joints, and also stabilizing exercises. More range of motion activities. If it's a herniated slip disc with sciatica, we got to decompress, we got to stretch, we got to get the pressure off the nerves. Once we get the pressure off that sciatic nerve, then we can go into conditioning and then we can fix your mechanics because a lot of these problems are posture related. So is it the same? Yes, but they're all different. And your care is different. Every patient should and needs to get treated differently because everyone is treated differently. That's what I bring to the table as an integrated approach to chiropractic, corrective exercise, physical modalities, and nutritional support to facilitate healing. That's why we call the office DeFabio Spine and Sport Rehab. It's not just adjustments, it's not just exercise, it's a whole body approach. And to tap it all off, we finish it off with inserts in your feet sometimes. So really, it's a whole body approach. You can get a copy of our low back core exercises, level 1, 2, and 3. Just email me. I really want you to take this information, empower yourself to making the choices to take charge of your health. I'm Dr. Donald DeFabio. Thanks for tuning in.